As you move forward, keep in mind that every positive change you make, no matter how small, contributes to your overall well-being. Aging is not a time of decline, but a time of deepened wisdom and understanding. And with that understanding comes the ability to take charge of your health in ways that support both your physical and emotional needs. By approaching intimacy with self-compassion and being attuned to the needs of your body, you're not just improving your sexual health, but also enriching your life in ways that extend far beyond the bedroom. If there's one thing I want you to take away from this, it's that your body still holds immense potential for pleasure, joy, and connection, no matter your age. You are worthy of feeling comfortable, confident, and alive in your body. And with patience, presence, and a little bit of care, you can reclaim your vitality and experience deep satisfaction in ways that align with the changes your body has gone through. So as you move forward with these new tools, practices, and insights, remember to be gentle with yourself. Progress doesn't happen overnight, and that's okay. What matters most is the intention behind each change. And each time you make space for listening to your body, you empower yourself to live a life that is full of vitality and connection, both with yourself and with others. There is no set timeline for when you'll feel the shift, but know that your efforts are leading you to a more fulfilling and empowered future. A future where you honor your body and its needs. A future where intimacy and self-pleasure are fulfilling, joyful, and integrated into a healthy, balanced life. Thank you again for reading and for investing in your own health. I hope this message has been helpful, and I encourage you to share it with those who may benefit. The more we talk openly about these experiences and embrace the natural changes of aging, the more empowered we all become. Remember, you are never alone on this journey, and you have the power to shape your health and your future. Take it one step at a time, and know that change is not just possible, it's within your reach. Your best years are ahead of you. Stay strong, stay empowered, and always be kind to yourself. If this message has resonated with you or you have any questions, feel free to leave your thoughts or feedback in the comments. Let's continue the conversation and support each other on this path to better health and deeper connection. If you're a woman over 60, there's a private habit that could be quietly affecting your health, and it's something rarely discussed. It's a subject many of us find familiar: masturbation. While this act may seem perfectly natural as we age, our bodies can respond differently. What once worked in your 30s or 40s may now be unknowingly putting strain on your pelvic floor, diminishing your sensations and draining your energy. But don't worry, you're not alone, and these changes can be addressed. I'm Dr. Lisa Perriera, and as a physician who specializes in geriatric care, I've spent decades supporting women through these transitions, helping them maintain their vitality and well-being well into their later years. Today, I'm here to guide you through some of the silent habits that might be affecting your health and offer practical advice on how to approach intimacy and self-care in a way that works with your body, not against it. Before we dive deeper into this important discussion, I encourage you to subscribe, like, or comment below. If you find this message helpful, let's keep this conversation going and help more women thrive. One of the most common and subtle mistakes women over 60 make is forcing arousal and rushing to climax. Many of my patients, like Susan, express frustration, saying things like, "It used to be so easy, but now I feel like I have to push harder just to feel something." This concern is more common than you might think, and it reflects a significant change that occurs as we age. Hormonal shifts lead to changes in lubrication, nerve sensitivity, and the overall sexual response. But many women don't adjust their approach to self-pleasure, trying to replicate the intensity and pace they once had in their younger years. Forcing arousal or rushing to reach climax can cause harm to delicate tissue in the vaginal and vulva areas, leading to micro tears that can irritate the clitoris and strain the pelvic floor. Over time, this cycle can lead to chronic discomfort, reduced sensitivity, and in some cases, painful intercourse. I've seen women experience ongoing dryness, pelvic discomfort, and even urinary issues without connecting it back to how they've been approaching self-pleasure. The key here is to stop forcing your body to respond the way it did when you were younger. It's time to slow down and listen to what your body is telling you. This might mean taking more time using lubrication and focusing on the sensations, rather than simply rushing toward an endpoint. Let your arousal build naturally without putting pressure on yourself or your body. Another mistake that can impact women's sexual health after 60 is relying too heavily on pornography for stimulation. I've had many patients like Margaret tell me that they can't seem to feel anything unless they're watching something online. Over time, your brain processes stimulation differently, especially as we age. High-intensity content can overstimulate the brain's reward centers, making it difficult to respond to real-life intimacy in the same way. This desensitization can cause a disconnect between your physical responses and your emotional or relational intimacy. What happens is that your brain becomes accustomed to the extreme, fast-paced stimulation that pornography provides, leading to a decreased ability to feel satisfied with real-world touch and connection. It's not about morality, it's about biology. Overuse of pornography can rewire your brain, making it harder to enjoy physical closeness and intimacy with a partner. It may also lead to feelings of isolation, emotional disconnection, or even depression, which can affect your overall well-being. So what can you do about this? Begin by reducing your screen time. Start exploring other ways to reconnect with your sensuality, such as through memory fantasies or reading erotica, which can help you rediscover the pleasures of touch and connection without relying on screens. Your brain can adapt and regain its sensitivity, so long as you intentionally engage with real-life intimacy. Now that we've discussed two of the most common mistakes women over 60 make when it comes to self-pleasure, let's move on to a third, quieter mistake that can affect your overall energy and well-being. It might be the reason some women feel drained and lose interest in life without understanding why. Mistake 3 is masturbating too frequently for your age and energy levels. I recall a patient, let's call her Helen, who came to me one day clearly exhausted. She sat quietly for a moment before asking, "Is it possible I'm doing it too often?" At 71, Helen was generally in good health, but constantly tired, irritable, and unable to focus. Her sleep was disrupted, and her interest in activities she once enjoyed, like gardening and attending her book club, had diminished. She had chalked it up to getting older. However, upon deeper investigation, we discovered something else. She was masturbating almost daily, sometimes more than once a day, thinking it was helping her relax. In reality, it was silently draining her. There's an assumption many women hold that orgasm is always healthy and always a release. While this was often true in your 30s and 40s, the rules change after 60. Your body's hormonal recovery slows, your nervous system takes longer to reset, and your energy becomes a more precious resource. Frequent orgasms, especially when you're already stressed, tired, or bored, don't always calm your body. Instead, they can deplete it. The problem with this mistake is that it's not always obvious. It doesn't manifest after just one session or even 5. Over weeks or months, you might find yourself waking up groggy, feeling drained, or losing the motivation to engage in activities you once enjoyed. At first, you might simply think it's just a part of aging, but your body could be signaling that it needs more rest, not more exertion. Masturbating too often when your system is already taxed can lead to hormonal imbalances, disrupted sleep cycles, and even strain on your pelvic floor, causing bladder urgency and frequent nighttime awakenings. This doesn't mean you need to stop entirely. In fact, some level of sexual expression is healthy at any age, but it should align with your body's current rhythm. Where you might have once bounced back quickly, now you might need a few days. The key is to listen, not push. For some women, reducing frequency to once or twice a week leads to a noticeable boost in energy and emotional balance. Others may explore forms of intimacy that don't require orgasm, but still provide connection and pleasure. When you stop treating your body like a machine and start treating it like a wise, responsive partner, everything shifts. You regain strength, not by doing more, but by doing less with more care. Mistake 4 is a critical one: ignoring pelvic health and hygiene during self-pleasure. I vividly remember a patient who came to see me with a subtle but nagging complaint. We'll call her Eleanor. At 68, she was active and relatively healthy, but she had been experiencing recurrent urinary tract infections, UTIs, that she couldn't explain. She hadn't connected the issue with her solo habits. She told me, "I've always done it this way, Jean." This seemingly harmless statement highlights the danger of habits. We often overlook habits that can have serious long-term consequences. As women age, particularly after menopause, the pelvic area becomes more vulnerable. The tissues in the urethra and vaginal areas thin, making them more prone to irritation and infection. During masturbation, especially if done with unclean hands or toys, bacteria can be introduced into the urethra. If you don't urinate afterward, the bacteria can lead to recurrent infections. Certain positions during masturbation that put strain on the pelvic floor can also create a perfect storm for pelvic pain, UTIs, and chronic irritation. The problem isn't just an occasional infection, it's the cumulative damage over time. This quiet strain can interfere with bladder control, causing issues like urgency, a weak urine flow, and frequent nighttime trips to the bathroom. You may also experience a burning sensation when urinating, or a general feeling of tension in the pelvic area that never fully subsides. Yet many women don't connect these symptoms with how they're touching themselves. They attribute them to aging, diet, or simply accept them as part of getting older, but they don't have to be. The good news is that small changes can make a significant difference. Simple habits like washing your hands and cleaning any toys before use, ensuring you urinate after climax to flush the urethra, and adjusting your position to relax your pelvic muscles can greatly reduce the risk of infections and discomfort. Taking care of your pelvic health is about more than avoiding disease. It's about preserving your comfort, confidence, and control over your body. Many women in their 70s have regained peace and comfort in their pelvic areas by simply being more mindful and making a few changes to their self-pleasure routine. Now that you're aware of these 4 silent mistakes, forcing climax, relying on pornography, overdoing it, and neglecting pelvic health, let's talk about how to rebuild strength, sensitivity, and satisfaction in a way that works for your body as it is today. You don't have to accept these changes as a decline in your sexual health. With awareness and a willingness to adapt, you can experience intimacy and connection in a new and fulfilling way. Now that you understand the 4 most common mistakes, it's time to focus on how to rebuild strength, sensitivity, and satisfaction after 60. It's important to remember that your body is still capable of pleasure, connection, and vitality. The key is to approach your sexual health with a fresh perspective and adapt to your body's current needs. With a few small changes, you can rekindle the intimacy, comfort, and confidence you deserve. The first step in rebuilding strength and sensitivity is to slow down and listen to your body. Stop pushing for the intense sensations you once had in your youth, and instead give yourself time to explore what feels good in the present moment. Masturbation and intimacy should be about connection, not rushing toward a goal. Focus on building arousal gradually. Use gentle, intentional movements and experiment with different types of touch or pressure. The goal is to enjoy the journey, not just the destination. Additionally, quality lubrication can play an essential role in making intimacy more comfortable and pleasurable. As we age, natural lubrication decreases, which can make self-pleasure or intercourse uncomfortable. Using a water-based or silicone-based lubricant can reduce friction and make the experience more enjoyable. Don't hesitate to try various products to find the one that works best for you. Your body deserves the support. Another important shift is to let go of the pressure of needing to reach orgasm every time. In fact, many women report that they feel more satisfied when they stop fixating on climax. Orgasm should not be the ultimate goal. It's about feeling the sensations, enjoying the connection, and experiencing the intimacy of the moment. By rethinking what pleasure means to you, you can open yourself up to a broader range of experiences that don't have to involve orgasm every time. The goal is to feel good in your body, regardless of the outcome. It's also essential to incorporate mindfulness into your routine. This means being present in your body, paying attention to your sensations, and creating an environment that fosters relaxation and comfort. Practicing mindfulness during self-pleasure or intimacy allows you to connect with your body on a deeper level. You may even consider incorporating breathing exercises or gentle meditation to help quiet your mind and stay focused on the sensations you're experiencing. When it comes to pelvic health, don't overlook the importance of strengthening and caring for this area of your body. Gentle pelvic floor exercises, such as Kegel exercises, can help strengthen the muscles that support the bladder, vagina, and rectum. These exercises not only help improve bladder control, but can also enhance sexual pleasure. A strong pelvic floor contributes to a healthier, more responsive body, and they're a simple yet effective way to support your sexual well-being as you age. It's also crucial to practice good hygiene and incorporate healthy habits. Regularly washing your hands, cleaning any toys or devices, and making sure to urinate after self-pleasure can all help reduce the risk of infections. Stay hydrated and consider using a mild, fragrance-free soap for sensitive areas. These small actions can go a long way in maintaining your comfort and preventing discomfort. Remember that sexual health is about more than just the physical act of pleasure. It's about maintaining your emotional well-being and nurturing the connection with your own body. If you've been struggling with feelings of isolation or emotional disconnection, it's important to address those as well. Reach out to a partner, a close friend, or a therapist if you need support. You are not alone in this, and there is no shame in seeking help. As you learn to adjust to your body's new rhythm, you can rediscover joy and satisfaction in intimacy. Lastly, know that these changes won't happen overnight, and that's perfectly okay. Be gentle with yourself and give your body the time it needs to adjust. Celebrate the small victories, like feeling more in tune with your body, enjoying the touch of your partner, or simply feeling more comfortable during intimate moments. These shifts are part of a greater journey toward accepting and nurturing your body as it evolves. There's no need to rush. It's about embracing the present and creating a healthy, sustainable relationship with your sexuality. By making these small but meaningful changes, you can embrace a new chapter in your life that's defined not by decline, but by wisdom and self-care. Your body still deserves love, respect, and attention, and the changes you make today will positively impact your sexual health for years to come. If this message resonated with you, please share your thoughts in the comments below. And if you know someone who might benefit from hearing this, feel free to share this article with them. Together, we can support one another in embracing aging with grace, vitality, and confidence. Thank you for taking this step toward a healthier, more mindful approach to your sexual health. You've got this. ChatGPT Jan Noi. With these changes, you're not just transforming your physical health, but your emotional and mental well-being as well. As you embrace a more mindful and intentional approach to intimacy, you'll begin to notice improvements in various aspects of your life. It's about more than just the mechanics of self-pleasure. It's about reclaiming your power and connection with yourself. Many women, even in their 70s or 80s, report feeling more vibrant, alive, and connected to their bodies than they did in their younger years. It's a testament to the fact that change is always possible, no matter your age. Don't be afraid to try new things. Explore different types of touch, different rhythms, and different ways to experience intimacy, whether on your own or with a partner. Be curious and open-minded. The process of rediscovery is a beautiful one, and it doesn't have to be rushed. Remember, your body is not a machine to be fixed. It's a dynamic, evolving part of you that deserves care, understanding, and respect. As you continue to listen to your body and honor its signals, you may find that intimacy becomes not just a physical experience, but a deeply emotional and empowering one. Your body is a lifelong companion, and as you approach it with compassion, it will respond with gratitude. Every small adjustment you make is a step toward feeling more connected, confident, and at peace with yourself. And while these changes may seem subtle at first, they will have a profound effect over time. You'll notice increased energy, a greater sense of sexual satisfaction, and a deeper connection with your partner. Intimacy can be a source of joy and vitality, even as you age, as long as you approach it with care and respect. In closing, I want to remind you that you're not alone in this journey. Many women go through similar challenges, but by sharing our experiences and supporting one another, we can foster a sense of community and understanding. Together, we can break the silence around these topics, normalize the changes we experience, and empower each other to live our best, healthiest lives at every stage. So take this message with you and begin to make small, thoughtful changes in your routine. Start by listening to your body and allow yourself to explore a new, more intentional path toward intimacy and self-care. It's not about doing everything perfectly. It's about doing it with mindfulness, patience, and respect for the body you have now. If this message spoke to you, or if you've learned something new, please share your thoughts in the comments below. And if you know anyone who could benefit from hearing this, don't hesitate to share it with them. Sometimes one conversation can make all the difference in someone's life. Thank you for taking the time to read and reflect. Together, we can help each other grow, evolve, and live life with vitality and purpose. As you move forward, keep in mind that every positive change you make, no matter how small, contributes to your overall well-being. Aging is not a time of decline, but a time of deepened wisdom and understanding. And with that understanding comes the ability to take charge of your health in ways that support both your physical and emotional needs. By approaching intimacy with self-compassion and being attuned to the needs of your body, you're not just improving your sexual health, but also enriching your life in ways that extend far beyond the bedroom. If there's one thing I want you to take away from this, it's that your body still holds immense potential for pleasure, joy, and connection, no matter your age. You are worthy of feeling comfortable, confident, and alive in your body. And with patience, presence, and a little bit of care, you can reclaim your vitality and experience deep satisfaction in ways that align with the changes your body has gone through. So as you move forward with these new tools, practices, and insights, remember to be gentle with yourself. Progress doesn't happen overnight, and that's okay. What matters most is the intention behind each change. And each time you make space for listening to your body, you empower yourself to live a life that is full of vitality and connection, both with yourself and with others. There is no set timeline for when you'll feel the shift, but know that your efforts are leading you to a more fulfilling and empowered future. A future where you honor your body and its needs. A future where intimacy and self-pleasure are fulfilling, joyful, and integrated into a healthy, balanced life. Thank you again for reading and for investing in your own health. I hope this message has been helpful, and I encourage you to share it with those who may benefit. The more we talk openly about these experiences and embrace the natural changes of aging, the more empowered we all become. Remember, you are never alone on this journey, and you have the power to shape your health and your future. Take it one step at a time, and know that change is not just possible, it's within your reach. Your best years are ahead of you. Stay strong, stay empowered, and always be kind to yourself. If this message has resonated with you or you have any questions, feel free to leave your thoughts or feedback in the comments. Let's continue the conversation and support each other on this path to better health and deeper connection.